we have been underpaid for what we give for a very, very long time, and enough is enough.
We are one of the lowest paid public sector workers, but with the highest demand. So we need this government to start listening.
We've had 13 years of this Tory government now, and they are absolutely destroying the very fabric of our country.
Today for me is not just about nursing pay. This is about protecting our NHS for the future, and not just the NHS, our health and social care system as well. We are offering, as an RCN, an olive branch to the government to say, let's sit round the table and negotiate. Because it takes a special person to come and work in NHS or health and social care. And one of the top values that the nursing team hold is showing that compassion every day in their working lives. We need the government now to smell the coffee. We need them to sit round that table and start showing their compassion, because we are one of the lowest paid public sector workers, but with the highest demand. So we need this government to start listening and start showing that compassion and start talking.
Why have you come down to the picket today?
So we're here today to send a very clear message to the Labour Party, as Labour Party activists and members, that the Labour front bench and Keir Starmer should get off the fence and unequivocally show their support and solidarity for striking workers. Today we're at the nurses' picket down at King's Hospital, and it is absolutely absurd that the Labour Party are too afraid currently to show their support for nurses after everything that they've been through over the last 3 years. These nurses here are taking a day's pay cut to stand on a picket line, to fight for the future of the NHS, to fight for the future of their profession, and to essentially just have a bit of pay restoration so they can have a square deal from this government, so they can go to work and not have to worry about how they're going to pay the bills.
I'm here today because I have been passionately working in the NHS for 13 years, and I've seen in that 13 years increasing reduction in the level of staffing and the quality of care that we're giving our patients. We've propped up and been a crutch for the NHS for many of those sort of the last 10 years, and we're tired and we need to be listened to. And the first step for us to feel as if we're listened to is fair pay.
When Steve Barclay didn't want to end strikes, he didn't want to get round the table, how did that make you feel?
I think it's just avoiding the subject. I think it's not helping. You know, anything in any kind of organisation, whether it's the NHS or health and social care, or to be fact, any public sector worker that works so hard, you know, our police force, our teachers, our fire brigades, our nursing workforce. It's about kind of getting around that table and talking, because, you know, sometimes just by having a talk you can make so much waves, you can make so much more partnership working, you can get so much more done, and you can kind of come to some kind of negotiation. And that's all the RCN is asking for. They're asking, let's get those talks happening, let's start chatting to each other to see where we can go with this. And this is what we need our government to do, to start showing that compassion, and something that our nursing workforce show every day.
You're losing a day of pay today. I don't think the public really understand that. I mean, how does it feel to make that sacrifice during a cost of living crisis?
It feels like a sacrifice worth making for the future of the NHS. I feel passionately enough about the cause to lose that, but there will be hardship. I barely make ends meet as it is, so there will be financial repercussions. But unlike certain people in the government, I'm willing to make ends meet. I'm willing to make those sacrifices in order to save the NHS.
Please, come on. Let's the government get behind this and start supporting our NHS and also our health and social care nursing workforce. Because this is about retention, this is about keeping our talented workforce in jobs. This is about the future. This is about saying to people, please come and be a student nurse, please come and be a nursing support worker, please come and be a registered nurse. So we need to be making sure that the government is saying, we are behind you, we are going to pay you a decent wage.
We will fight tooth and nail for an NHS, like absolutely without any semblance of privatisation at all. The private sector have got absolutely no place within the NHS. You know, the NHS was founded by the Labour Party on a universalism principle to be free at the point of use. And if you create a two-tier system, you're basically degrading the very foundations of the NHS. So the Labour Party, Keir Starmer and Wes Streeting, should have nothing to do with the private sector. They should be unashamedly supporting the NHS as a nationalised model, free at the point of use, with a workforce that feel fully supported and have the backing of the Labour Party, have the backing of the government, and a decent pay deal at the end of it.
I think it is about keeping those people in their jobs, because people want to be in their jobs, and I think it's also saying to people, come on, be a student, be a nursing support worker, be a registered nurse, come and join the NHS, come and join health and social care. So we need that offer to be that people go, do you know what, that is something that that's sustainable, that's something that I can join that profession, and I know that I'm going to be on a decent wage, and that's what this is all about.
Do you think that the public are on your side?
Absolutely, absolutely. I've been overwhelmed by the support from the public. I've been overwhelmed by the support from people in my own personal life who have always been sort of very almost pro-privatisation of the NHS, because we know that it's been struggling for a long time. A complete 180 from them, fully supporting now, because they now understand the problem, because we have a collective voice. They're now hearing the facts, not just what the government want us to hear.
I definitely think we've got the public support. I've seen it on, previous strikes and industrial action. The public have been coming down. They've been coming down with hot food, with drinks. They've been coming down and supporting us, and even offering to wear our RCM badges so that they can support us in the public as well. And I think they are, because who uses our services? Me and you, and the public. They use our service probably more or less every day. So the public are so behind us.
Keir Starmer and the Labour Party front bench need to get off the fence. They need to come down to these picket lines and show support for striking workers. The strikes aren't going away anytime soon. We've seen ballot results come out for teachers, potential ballot results coming out for firefighters. So the Labour Party needs to get in step with public opinion. These nurses down here have got a huge amount of public support. Every single opinion poll that's coming out is showing huge support for nurses striking action. So the Labour Party needs to stay true to its values and its beliefs and come down and support these striking workers to ensure that they get a square deal.
It's fairly commonplace for people to talk about how sort of overworked and understaffed we are, but it goes beyond that. We're not invested in. Poor access to education, poor funding for education and progression, it means that we're not providing the level and quality of care, even when we do have boots on the ground and people working on the wards.
I think this country is at the point now where our public services are completely crumbling. And, we really need to see some coordinated action across the board from our trade unions to put as much pressure on this Tory government. We've had 13 years of this Tory government now, and they are absolutely destroying the very fabric of our country. So if we can't have a general strike now, when could we?